Yeah, I think for me, some of the numbers of the, when you get those statistics of 1 in 3, when you hear about the 20% of older people being, I suppose, a victim of some form of elder abuse, that is unacceptable in the system. And we're really glad that this report has come down, that the Royal Commissioners have handed down a report that is quite broad, because these are the cases that older people are bringing to us, to our aged care advocacy services every single day, where they're saying this is not good enough, we need to improve the system, we need a better standard of care in the system, but we also need to listen to older people, and they need to be part of the design of this system, which we were pleased to see that there's a framing of that around the Aged Care Act, the new Aged Care Act, but also around the sort of services and the governance of the system as well. And that's what we want to now work with government to move forward with this, to implement a comprehensive plan of transformation for the aged care system, because every older person in Australia deserves that.
The list of recommendations is a long one. What needs to be the priority in your view?
I think the priority is getting the home care waiting list down. I think that will fundamentally change, but that needs to come with a workforce plan that actually looks for the longer term, 5 to 10 years, about how we're going to have staff that are of the right attitude, the right training, and the right aptitude to actually support our older Australians and make sure that they get the care at home that they deserve. On top of that, we're really pleased that there was a recommendation 106, that talks about the need for every older person to have access to aged care advocacy. People have to be able to raise their concerns and issues and help those issues to be flowing into the improvement in the system as we move forward. But people need the supports to do that. So more aged care advocacy, we were very pleased to hear a recommendation on that.
Are you satisfied with the response from the Prime Minister, from the government so far? We've been reporting $500 million is being thrown at the problem initially, while the government does come up with a more detailed plan, which we'll learn about in the next budget. Can we have confidence, do you think, that this government will actually make this happen?
I think the community is going to keep the government, and as I think the community and the commissioners have put the government on notice to say that this has to deliver long-term transformational change so that we can have a sustainable system, we can have an effective system, but a system that gives timely access to aged care, framed around a new Aged Care Act. So we're very pleased with what was announced yesterday, but more needs to be done, and I think there's been strong indications from the government that they will move forward towards the May budget, where a fuller answer to the broad number of issues, those 148 recommendations, we do need to take time to unpack that for this to be done appropriately, but to bring the transformation and the change that we want to see in the longer term.
Craig, just on another matter, I know you've been following the rollout of the vaccine in the aged care sector really closely in the past week or so, since we've seen that getting underway. We had that initial bungle early on in Queensland with the 2 older Australians being given 4 times the recommended dose of the Pfizer vaccine. Since that point, has everything been smooth? Are you happy with the way that the vaccine is being rolled out to our older Australians?
Yeah, I think that the government is listening. The Department of Health definitely has taken on board the concerns around older Australians having the information that they need to make the decisions and make informed choices about the vaccine, that they need time to have a supported decision-making approach, that it's not being done to them, but it's working with the older person to allow them to make the choice around the vaccination. On the logistics, I think there are still some logistical challenges, and that will happen. It is a massive undertaking to get this vaccine to every older Australian who wants it, but also to the workers, the quarantine workers, the aged care workers that need to be out there and protected from the COVID-19 virus as well. So it's definitely improving, and I think we'll see continuing improvement over the coming weeks as I suppose we get into this rhythm of rolling out what is the most massive undertaking of vaccination that we've really ever seen in Australia. But I also know that older people, they are the ones with the experience of having smallpox vaccines, of having polio vaccines. So I'm really pleased that there's been a high uptake of the vaccination program as well.
And when you talk about that vaccination uptake, is that among aged care workers as well? I know there's been a lot of debate and discussion as to whether or not the vaccine should be mandatory for people who want to or who have jobs in the aged care sector. Do you think it might end up getting to that point where it needs to be made mandatory, or are we seeing really high levels of uptake so far?
Yeah, so Australia has got, and even with our healthcare workers and our aged care workers, we've got a history of quite substantial uptake of vaccines. And so I think when the vaccine needs to start rolling out for staff, the priority has been residents of aged care facilities at this point in time, and that's appropriate because they are the most vulnerable to this disease. But as we start to work with staff, we need to also give the same information to staff that it is a safe vaccine and it is effective in, I suppose, reducing the risks of serious illness. And we do this with other like MMR, we do this with mumps and rubella and those sorts of diseases. So people should have confidence, I think, in the TGA has done its work in looking at this, and that as we move forward with staff, that we're giving them the time to have that considered approach. But we do want to see high levels of uptake. We're strongly encouraging people to get the information they need to make their own choices and decisions, but think about that and also think about what this does for the community as well, and getting us into COVID normal and I suppose a recovery out of the COVID-19 pandemic.
Craig Gear, appreciate your insights. Thanks so much.
Thank you.